The purpose of the Medscape application is to offer healthcare providers an easy, accessible way to find pertinent clinical information. This application is used as a quick reference for medications, conditions, and procedures. It also delivers news articles about current issues in the medical field. The Medscape application includes continuing education opportunities as well. Nurses can benefit from using the Medscape application because of the ease of finding information about medications. Medscape contains an extensive drug library. If one needs to look up information about Coumadin, click on the reference button on the home screen, select drugs, and type Coumadin into the search bar. There is now access to dosage information, adverse effects, drug interactions, warnings and contraindications, formulary of brands, pharmacology, administration and pregnancy considerations. One can also save the drug into a library for further use. It is easy for a nurse to find information about patient conditions via the Medscape application. This information can be used as a quick reference for hundreds of issues a patient may experience. The conditions are organized into many different categories for easy navigation. For example, a patient is experiencing atrial fibrillation. There is an overview of the condition that includes pathophysiology, etiology, clinical presentation, diagnostic testing, treatment and medication, and where to find patient education resources. Medscape is an excellent application to review procedures that are commonly performed. For example, a patient is experiencing asystole. Ideally, one would already know the basic life support. However, a new nurse in critical care wants to brush up on her skills. She can use this information to find ACLS. Go to Procedures from the reference menu, select ACLS and BLS. From there, select ACLS and asystole. There is step-by-step instructions on how to perform ACLS for a patient in asystole. There are several tools that are embedded into the Medscape application that are useful. There is a drug interaction checker. Let's say a patient is taking warfarin and wants to know if it interacts with any medications he or she is taking. It is easy to find that the patient should not be taking vitamin K while on warfarin. There are calculators that pertain to several different conditions. For example, the NIH stroke scale. Just input the information into each category and it will calculate the score for you. Also, the Medscape application provides a directory to physicians, pharmacies, and hospitals. Medscape provides some of the latest news articles pertaining current issues in the healthcare field. Any legal or ethical issues pertaining to the Medscape application can be viewed on the application under the Information section. It includes the terms of use and the privacy policy. In the terms of use, it clearly states that the information on this website should not replace the advice of a professional. The Medscape application can be downloaded for Apple or Android devices. The application can be downloaded and used for free. The only limitation is that one needs internet access to retrieve some of the information. However, one can also download the full library to the device for offline use. This does take up some space on the device, though. With a free account, one can receive continuing education credits. Opportunities are gained through the app itself or through email. What are others saying about this application? According to Download.com in 2014, the developers deserve kudos for fitting so much information into a lightweight interface. The pages for drugs, conditions, and procedures are especially well organized and comprehensive, making this app about as good as a medical handbook, but more accessible. In conclusion, the Medscape application is an incredibly useful tool for medical professionals, especially for nurses. It is easy to access pertinent information, including medications, conditions, and procedures. It has useful tools such as a drug interaction checker, calculators, and medical directories for hospitals, physicians, and pharmacies. There is access to current news and continuing education. The presenter of this video would recommend using this application. She uses this app almost every day in her clinical setting and for personal use. References.